Hello, everyone. I'm one of the team members from Sprint. And it's a challenge and honor to me to start with very initial things that we started within the Sprint. So the challenge was to define what do we call social investment in long-term care. So my presentation is it's a joint collaboration of several colleagues, and I'm only one of the speakers, and together with me, this presentation was prepared by Alexandra Lopez from Porto University and by Hans Reinhardt from Fulda University. Where is Hans? Okay. So I will briefly present concept of social investment within LTC domain and its dimensions, then legal aspects, and briefly will introduce main outcomes of our interactions in consultations with stakeholders concerning social investment concept. So we started, when we looked at different definitions that were used in relation to social investment, we couldn't find anything in relation to long-term care. So we had to define from very beginning what do we call social investment in long-term care from, when we started our internal conversation among the colleagues. So finally we decided that we would consider social investment as welfare expenditure that relates to equitable access to care and meeting of needs of aging population and improving quality of life and quality of care and quality of life. Together at the same time, increasing capacities to participate in society and economy and promote sustainable and efficient resource allocation. So it's very complicated, but to make it more clear. So mostly it is related to several domains. So first domain is about potential impact of provision of care services, enabling those potential carers and increasing need of especially informal carers to participate on labor market. And as Mrs. Pereira was presenting, this is mostly related with female participation on labor market. The second dimension is about independent living possibility of those elderly and postponing as long as possible their institutionalization. As in most of countries, as we realize, this is only alternative for quite a few of elderly people. Next aspect that we were thinking it would be worthwhile to look, it's about equity problems in access to long-term care, because we realize that there is broad diversity among regions, among countries, so it's more about equity and efficiency also in use of public resources. So it's social investment about well-being on both sides, for receiving care and for those who have caring responsibilities. And another impact of those other externalities that are related with LTC. So starting with that initial definition and potential dimensions of social investment, then we looked at legal aspects. How does it look like among European countries? So what we found that there is no individual right to LTC, but LTC is included as social pillar. That's why all member states are should provide citizens with more adequate long-term care. And looking again at variety of provisions among European countries, we realize that it's even difficult to have more systematic approach because such variety in scope of application and type of an amount of benefits, organizational aspects, involvement of different stakeholders, it's very difficult to categorize. So when we defined social investment, when we looked at the legal situation within long-term care, among European countries. Then we decided that it's very important to talk to stakeholders from very beginning, because very often we hear that there is no common language among stakeholders and academicians. Before digging deeper into academic matters, we realized that it's very necessary to talk, if we have common perception, what is successful long-term care, what are the success factors, and if the term of social investment is known to stakeholders. Within a sprint study, in quite initial stage of the project, we had consultations with stakeholders about their perceptions of success within LTC, success factors, and knowledge and understanding of social investment. We performed a qualitative study, and the study was done in 8 countries, and we had 62 participants. And what do we find? We found out that in spite of very diverse variety among countries that were researched, perception what is success, it's quite similar. And success on national, institutional, and individual levels. All stakeholders were talking about consistency of national policy. They were talking about necessity to integrate social and healthcare systems, especially when responsibilities are divided between the 2 sectors. Talking about institutional success stories, a lot of stakeholders provided a lot of examples, and what was surprisingly to find out that not private institutions most often were mentioned as success stories. Those were mostly either non-governmental initiatives or public sector institutions. And talking about individual level, most of the stakeholders were talking about necessity to enable elderly people to live as long as possible at home without being institutionalized. Then when we asked stakeholders how do they see what are the most necessary criteria to have those success stories, again, stakeholders were identifying a variety of different aspects on different levels. So first of all, they were mentioning that in quite a few countries, there is inconsistency in national long-term care policies, especially when different aspects of long-term care policies are divided between health sector and social sector. They were talking about adequate supply and availability of services. And again, regional differences, marketization, equity problems were mentioned as very important in avoiding those problematic issues within provision of long-term care. And of course, when going to individual level, most of the stakeholders were saying how important is that personalized approach. And different dimensions of that personal approach, I'm not going to go in details. I cannot read even from here. So next stage that we were talking to stakeholders and trying to find out is about concept of social investment. So when we asked our stakeholders in different countries, from representing very different welfare traditions, representing very different resourcing patterns in providing of long-term care, most of stakeholders were puzzled. They didn't know what we are talking about to them. When our project definition was provided and explained, a lot of those moments that, yes, we know what you are talking about, and a lot of examples were provided that could be related to social investment within a long-term care domain. So the conclusion from this study was that, yes, social investment as a concept is not known, but phenomena is very much recognized by a lot of stakeholders within long-term care. Also, going deeper into discussion with the stakeholders on social investment concept, most of stakeholders were saying that it's possible to evaluate impact of social investment, but the concern was that it should not become only monetary expression of evaluation. Suggestions were made in different focus groups or in different individual interviews that we had among different countries. Effectiveness criteria was mentioned. And again, effectiveness could be measured by improved functional capacity of those receiving care or improved quality of independent living. Also, another aspect that was suggested, it could be cost and benefit analysis of preventative and healthcare promotion, different programs that could be integrated within this approach of social investment. So those are the main insights that we received from stakeholders. And to conclude, we realized that in spite of broad variety, in spite of very different patterns in resourcing, perception that success in long-term care doesn't vary too much in member states. Most of stakeholders agree that there are some criteria that are relevant in all the countries that we had interviews and focus groups. And again, that phenomenon of social investment is not something that is alien to the stakeholders. The concept is not known because probably most of stakeholders are not talking in those academic terms, but phenomena is recognizable and is relevant. So, thank you.
Thank you very much.